statue, Liberty started shaking her fist, and the eagle will fly, and it's gonna be here. I brought to you courtesy of the red, white, and blue.
It's time for Veterans Issues, the show that brings you information about veterans, military, and their family. Now here's your host, Ken Robbins.
Welcome to Veterans Issues. We are brought to you by the red, white, and blue. Sound like I got a frog in my throat today, but today's a great day for the show. We've got welcome back somebody from the VA hospital over in Birmingham. He's been here before. It's been too long, and we're going to bring us up to speed with what's going on at the Birmingham VAMC. So you stay where you are. We're going to talk with Jeff Hester. Stay right there. Ken. Welcome back to Veterans Issues. Thanks for staying with us. And today's show is one I've been looking forward to for a while, because we have a lot of in our area, we have a lot of people who utilize the Birmingham Veterans Medical Center, and we've got the public affairs director, and he's the go-to guy at the Birmingham VA. I'll just tell you that, and he's my friend, and his name is Jeff Hester.
Yes, sir. Good to be here with you, Ken.
Jeffery,
appreciate you having me.
It's Jeffrey, but I'm gonna call you Jeff.
You got it, Ken.
That's like if you was a prisoner and your number was 59692, you call me 5.
Yeah, that sounds good.
There you go. All right. But anyhow, I want to welcome you back. And last time you was here, well, you've been here to this set before, you?
Yes, sir. I haven't been here before. Me and Mr. Smith sat on the set here.
Yeah.
About a year ago, I guess it was. Yeah.
Tom Smith, the director over there, and we appreciate him coming down here. I got to see him a couple weeks ago, or a week or so ago. Time flies. I think we could probably do 3 shows with you, so let's try to do it all in one. What's happening with the VA right now, that just in Birmingham, forget the VA as a nation, but just in Birmingham VA,
Well, right now, the Birmingham VA Medical Center is doing very well. I mean, a lot of people are hearing some of these issues going on around the country, you know, like in Phoenix, like in Atlanta, like in Columbia or Augusta. You know, of course, that's our fellow facilities, and we're part of that system. Right. And then we all work together, have the same mission of helping veterans. But each of the medical centers around the country, each of the 151, have been reviewed through 3 phases. Birmingham had to go through a phase 1, which was the medical center, a phase 2, which was all of our community-based outpatient clinics, such as the one here in Oxford, Anniston. And then the 3rd phase is if they found things in that 1st or 2nd phase, they had to come out and do a re-review. We did not have to have a re-review. Right. We did have some learning opportunities and ways to improve during those first 2 reviews. We've taken action on those, and I think we're improving. Again, while the director couldn't be here today, he's in the clinics with the schedulers, watching them, meeting with them, in every clinic that we've got in the community as well as at the facility, making sure that we're doing things consistent across the board to make sure veterans get the care that they need when they need it.
He's out there where the rubber meets the road, and when he stands up and says we're doing A, B, C, or D, he's seeing it firsthand, and I was able to hear him talk about that down in Montgomery, and if anybody out there that ever met him, they know that he's a straight shooting guy. And I doubt very seriously, I'm over the veterans' homes, as you well know, that anybody couldn't walk in at any time if it's looking hard enough and find some little something. So for us to sit here today and say that there's probably not anything happening with all of them, you got 6 clinics or something like that?
9 community-based outpatient clinics.
That they couldn't find something that's not happening just right, for a lack of saying something wrong. But that don't mean that you're not trying to get everything, at the top of the scale. And I'm not sitting here saying that because as I leave here today, I'm going to the clinic. I got an appointment just a couple of hours from now. So I think I don't know about the others, as people just watching us here today up in Etowah County places, but I would argue with them that the one in Oxford is probably the best in the state. That if they got,
I'll let you have that argument.
If they've got the care we got in Oxford, then you got 9 great clinics, is what I can tell you. Because I've yet to find somebody here that's not top notch. That said, and I'm not saying it because I got an appointment there this afternoon, because this show won't air before I go down there. So that's now. One of the things that well, I want to touch more on that national thing as we get further in the show, but the things that's happening over there now, there's a thing with the renal plant. Do you want to go into that, the kidney clinic?
Yeah, for those that don't know, Birmingham was the 5th medical center in the country in the VA to start doing renal transplants. We were going to do our first April the 17th. For those that don't know, we were the first medical center in the state of Alabama to do a kidney transplant back in 1968.
I didn't know.
We've done that with our affiliate UAB. Since then, UAB probably does more in any given month than any other medical center in the country. So now we're going back to doing those again, becoming one of 5 in the VA system to start doing those renal transplants here again from veterans across the Southeast. Right now we have about 33 people on that list waiting to receive a new kidney. One of them will be a living donor transfer. The rest of them are on the list to get a kidney, you know, after somebody has passed away, and then that blood type and all that matches. So,
I know Director Smith mentioned that because of some kind of contamination issue of bacteria or something that not there. But what is the, not like Legionnaires or something like that? But
well, no, what it is, it's a Legionella bacteria. Every place has Legionella. Right. At your home, in a hotel, everywhere you go. The thing you want to make sure is that the levels are minimized.
Right.
So what we did when we found out we had a colony of Legionella is that we did what's called, we put new filters on a lot of the water pipes.
Line, yeah.
Then we did a thermal eradication, which was running the water up to 180 degrees, which kills all the bacteria, which only does that for 3 or 4 weeks though. The main system we're putting in is a chlorine injection system, which several other VAs have. And we did not want to be doing kidney transplants or renal transplants with the chance that somebody would get an infection with a new kidney that's supposed to bring life and then lose it because of a bacteria.
Absolutely.
So in turn, we wanted to err on the side of safety and make sure that our systems are together before we start doing more of those transplants.
So you're still in the business of doing it, though?
We're still in the business of doing them. We're just in the process of getting that new chlorine injection system put in, then we will resume doing them.
There you go. The other words I hear, and I'm bringing stuff off the top of my head that people have asked questions about the women's clinic, the women's treatment. That's a huge challenge for any VA.
It is, and I think Anniston's very familiar with that due to the Women's Army Corps. We've always had one of the hugest women populations out of Calhoun County here in Anniston, in Oxford, that are our women clinic patient users. We're in the process of building a new women's clinic. We have over 5,000 women veterans now we provide care to. And if anybody looks at the statistics, they can see at any given time now that 20% of your military coming out are women. So we definitely want to make sure that we're ramped up and we're ready for those women veterans being discharged to make sure they get the care that they're entitled to. And we do have a new GYN physician, a new nurse practitioner. We have a new physician in the women's clinic. So we're really putting resources there, making sure that the women are going to get the care that they're entitled to.
I remember years ago a high-ranking official in the VA says, we won't have to worry about providing women's care because after the World War II veteran dies off, there'll be no need for it. They didn't remember the thing about these Vietnam women that did it. Now, and in our nursing homes, we had 3 nursing homes, and that's my job is that. One of the things I noticed was they had 2 beds per room, you know, and you can't put Bubba and Billy in the same room, so they didn't think about women and the far out. And same way the VA, when they built the first VA hospital, and we might talk about that a little bit, they did not anticipate the veterans that they're treating today, the type illnesses, Agent Orange, and all the things, systemic heart disease, stuff like that.
And you're right. When we opened the medical center in Birmingham back in '53, we were a 479-bed facility. You know, you had a lot of individual rooms that were primarily used for TB, for those diseases that might be infectious, and then for some female veterans. We never put the female veterans in the big wards or the units, so, you know.
They're yelling, I got to go to a break because we have to pay the bills. When we come back, we're going to take up right where we left off with Jeff Hester. Stay where you are. Get that pen. Be right back. Welcome back into Veterans Issue. We're talking with Jeff Hester, and Jeff is the, the Public Affairs Director for the VA hospital over in Birmingham. And we left, we were talking about the women. You had to ramp up to take care of the women in there, and I don't know if you got to finish that before we had to go to commercial, but.
I'm never finished with my female veterans, no. Like I said, we have over 5,000 of them. We definitely want them to come back, get into care into Birmingham. We do try to provide female veteran care out at each of our CBOCs too. So we have physicians or nurse practitioners out there especially trained to handle our female veterans. So each clinic has that. So if they're not comfortable out at one of the CBOCs, they can come to the Women's Clinic in Birmingham.
You said you're building this new one. Is that going to be at the Birmingham facility?
It's going to be about 4 blocks away.
Okay. It's going to be a standalone?
It will be a 50,500 square foot clinic. It will be 3 stories high. We're moving the primary care out of the building at the hospital to this new building, along with a women's clinic with some PT, OT, a pharmacy, a lab, and with some audiology. So,
okay. One of the things that the veterans always talk about is the pharmacy, the prescriptions. Is there anything on the horizon that we need to give an alert on there? Because that's kind of a changing situation.
Not really.
It won't affect the veteran, but it is something y'all do.
Yeah, the biggest thing that I can think of is dealing with our pharmaceuticals. I mean, many veterans are on maintenance drugs for diabetes, heart, blood pressure, whatever that might be. That will continue. The issue is with narcotics and opiate safety kind of things. And that's not only occurring in the VA, that's a nationwide initiative. And we're trying to adapt to the opiate safety because we're trying to improve the quality of life for our veterans. So each physician will review those patients who are on narcotics and then make sure they're on the right dose, that it's working correctly, it's the correct therapy. If it's not the correct therapy, they might start titrating it down and then putting them on optional therapies, which could be mindfulness, Tai Chi, yoga. I mean, there's several new options that are coming out that veterans can work with without just depending on medication, because many of them started on medication 10 years ago. They had pain levels of 9 or 10. You ask them their pain level 10 years later, still 9 or 10. And now they're falling down and getting hurt and injured.
Because of the medication.
Because of the medication. It's basically took away a lot of their quality of life. It's made it unsafe for them. Yeah. What we're trying to do is get that quality of life back for them, but a lot of the veterans now have been taking it for a number of years, and it's hard for them to give that up.
Yeah, you just took my little stick away, because I know at least 2 veterans that is in that situation, that what they were taking 7, 8 years ago, they're older now, and that medication does not have the same effect on them, or has a larger effect on them now, because their system is not as resilient as it was then. That's what their doctors have told them.
Right, and so we leave that totally as a clinical decision. Right. You know, we try not to get involved in that administratively. We want the doctor and the patient to discuss that and what's going to be best for that patient. And sometimes the doctor and patient may not agree, but...
Yeah, probably every day it happens. But you know, that's like having somebody looking out for you. You got a spouse out there hearing what we're talking about today, that know that the VA is looking out for their husband, saying, we're going to call you in. Don't get mad. Just, we're going to talk to you about your medications. Maybe you need to take a little less, or maybe you need to take a little bit more.
Right.
And I've had a doctor tell me that. You're talking about falling and stuff. I have equilibrium problems. Anybody's got diabetes, it'll kick your butt. There are a lot of ways.
Sure, yeah.
And mine does. Anyhow, let's, the prescription thing there. Now, I was talking off the air with you about, we're going to face a huge challenge here by the end of this year when these veterans, the military, are discharged and come home from Afghanistan. And you're going to get a huge number of them. Mm-hmm. And that's going to be a challenge, because we had the World War II veterans. I saw somewhere somebody said they only had like 3 to 4 issues for a World War II veteran. Then came the Vietnam veteran has as many as 13 issues. To go from that, the hospitals were built to take care of this guy, a generic World War II veteran. They call shell shot back then, which we call PTSD.
PTSD now, right?
Yeah. So you're gonna be able to absorb all this. I know you're out looking, you're planning for these people.
Yeah, and we're definitely going to be able to absorb it. I mean, that's why we're building new clinics. That's why we're expanding. I mean, right now we have about 13,000 Iraqi, Afghanistan veterans who have returned back using the medical center. You know, out of our 62,000 veterans, and you know, a larger percentage, like I said, were female veterans. But you know, we have an outreach event this coming weekend at Regents Field in Birmingham at 3 o'clock for OIF, OEF veterans to come out and get all the services they need, and also enjoy a ball game with their family. So,
you know, that's one of the things is in the military, as we know, when you're getting ready to come home and you're discharged, there's not a whole lot of emphasis on what you need to do out there in the civilian life. I mean, it's not like you need to get into contact. I used to talk here, give them that number over a 205 number in Birmingham to call and enroll in the system. Maybe you're not sick now, but you need to get in there and enroll in the VA healthcare system. And that's the last thing on somebody's mind. I got to get my job.
And that was my biggest disappointment for many of our veterans. When I started there in '90, I told veterans to enroll. That way, when you need us, we're here. Many of them didn't do that. You know, in 2003, they came out with a new rule. In January of 2003, the secretary came out. If you're a higher income, non-service connected veteran, you can enroll, but you're not eligible for care. Right. Everybody who had enrolled before continued and was grandfathered in for care. So, you know, and I know a lot of our veterans, they think somebody else needs it worse than they do, but I mean, we're there for the veterans. We want them getting the care from us in Birmingham or at one of our clinics or another VA that might be closer to them in proximity.
Yeah, that's something that, like I said, is they're thinking about coming home, getting a job, stabilizing their home, and the last thing on their mind is that shoulder injury they had over in Afghanistan or that knee injury or whatever, and then all of a sudden they show up and they're not in the system. They got to start a whole lot further back of the line than they would if they, am I right?
Right, yeah. And when they come in, I mean, they have 5 years of presumptive care regardless,
right,
to make sure their needs are taken care of. But the thing is to make sure they're documented. I mean, 5, 10, 15 years down the road when they have problems with it, we've already got medical records that they've already had concerns and problems with their knee, their shoulder. That way we can service connect it, we can get them care for that, make sure that everything's covered. So that's
what I need to look in Camera 1 and tell those spouses out there that you're emailing and you're on the internet with your husband, or if it's the vice versa, or you're on there with your wife and they're serving overseas, make sure that they get documentation of any injury, no matter how big or small. Make sure they got documentation and set up their own set of records, if you will, so that when they come out, that's just my little lecturing thing I got to do, because too many times it's like, well, I got to find my record. I know I was injured on this date and I went on sick call, but I don't remember the date, don't even remember the year. And then we got to start back from square one to get care for it.
Yeah, and we're trying to make the system between DOD and VA seamless. And there's still some issues to work through there, and that way we will have the records for veterans who were injured if they got put in even DOD system when they got back, which a lot of them are not getting even put in there, let alone transferred over to the VA when that veteran transfers to us, you know. So
we got 1 minute left or less, and I want to dedicate some of it to parking. That's the most common word I hear about it. And Director Smith mentioned something about it. Tell me real quick.
We did. We just had a groundbreaking for the new clinical annex and the parking. When parking was mentioned, we got a standing ovation.
Sure.
The Birmingham VA Medical Center will have a new parking deck, 8 stories tall, 2,334 spots. All of our patients, all of our employees will be parking together, and it will be a great thing. Right now we have 3 leases all over the city with the Birmingham Parking Authority. It's going to be right next to the clinic. They can park and walk in to see their primary care provider. So, I mean, this is really something we're looking forward to, and it's going to be great news for our veterans.
Great news. Thank you, Jeff. I appreciate you coming down to doing the show, and this has been so informational. And will you come back?
Will
you send the director down here?
Me and the director will come together next time.
Mr. Smith, we need you down here. Come see us. We got to go to a break, come back. I've got news that you can use. Stay where you are. Get you a pen. Be right back. Welcome back to Veterans Issues. I appreciate Jeff Hester coming in and doing the show today. And if you've you got my contact information on there. If you've got any more questions for Jeff that we didn't discuss here today, then you send them to me. And then hopefully the director will get this time to come down here. But as you can understand, he's a very busy man nowadays, and maybe we can address those issues that we didn't cover here today. On July the 21st, I got to read this, so I just got it out of my iPhone. On the 21st of July, they're opening up, signing up the new Young Marines, another group of them. And so it's a civil defense building out there on Leatherwood Road at the Civil Defense. But here's the phone number, 256-310-6481. That's for the Young Marines. Now, folks, if you've got boys or girls, or we'll say male or female, that is a great, great program. I can tell you firsthand that you've seen some of them here on the show, some of them even going on up to join the Marine Corps, and it's great morals, and it's just a great program for kids. So 256-310-6481. That's Dan Long, and that's for the young Marines. If you want to sign them up and get them in there, that's a great program. Now, you've got my new contact information here on the screen, so that's the numbers I'd like for you to use. You can text me, you can email me at that email address. Now, this thing about, I mentioned every week about the automobile, if you know someone that's got a vehicle for sale that's serviceable and they get a tax write-off for it, if we can give them a tax write-off just like you're taking something to Goodwill or whatever, and they get a tax credit for it, and then we able to put that car in the hands of a grandmother that can go to their doctors or whatever, and I can assure you that it'll go to good use. So if you got one, contact me at that number, the 239-9234, and I will make the arrangements to do the paperwork on that for you. So if you've got a $2,500 automobile, you can't sell it, there's a good way to get your $2,500 tax credit. So help me out on that. Law enforcement tags. I tell you about them every week because they go good with everything, every kind of car you got. The law enforcement tag will benefit. It helps pay for the fallen officer memorial up in Washington, D.C., but the biggest portion will go here to Anniston, Alabama, to help build the official state law enforcement memorial for the state of Alabama. So if you go to getting a tag this month, go to the tag office if you want to look at the law enforcement tag. And Veterans Moments, I got to thank the WEAC TV24 and the father K.L. Brown, Representative Brown, Representative Randy Wood, and Representative Steve Hurst for sponsoring those Veterans Moments. We talked to you about all the bills that's been passed in Montgomery that is specific to veterans, and if without this program, I don't know how you'd find out about those bills. So thank them again for that. And don't forget the folks out there at the Cheehaw Regional Humane Shelter, 256-241-3647. If you can help them out with treats or anything like that, or blankets, that's a great deal. And we can always still use drivers for the DAV van, and if you'd like to be a volunteer driver to take people to the VA over in Birmingham, just let me know. Now, we're talking about parking. The parking is still at 2128 4th Avenue North, and she keeps telling me we're running out of time here, and I stutter and stammer. That's going to cause it. So I'm just going to give them a shout out, and I'm going to shout out to the ambassador of Anniston. I call her is Miss Betty Carr, the sweetest thing in the world, and I got to say hey to Caitlin and Bella. And this week's salute goes out to all those working in the VA hospitals and the clinic. And as I said, the folks here in Oxford did an awesome job, as do all of you folks in the VA. Thank you so much. See you next week here on Veterans Issues. Salute.